many signs of solidarity throughout the country and throughout the world. People are putting up rainbows to remind neighbors that better days are yet to come. And if you're in Montreal this evening, look at the Samuel de Champlain Bridge. It will be lit up with the colors of the rainbow.
I know these are hard times, but I also know that we're going to get through them together. Merci beaucoup tout le monde.
Thank you. We'll now go to the phone lines for first question. Please keep it to one question and one follow-up. Operator.
Thank you. Merci. La première question nous vient de Raymond Filion, TVA. À vous la parole.
Raymond Filion, TVA. Hello, Mr. Prime Minister. I would like to come back to another subject. Have you received any requests or are discussions underway so that the Canadian Army will intervene? I'm thinking of Quebec, where they're speaking of closing access to the city of Montreal. We know that the situation is quickly evolving, and we are prepared for different scenarios. Canadians know that the Canadian Armed Forces are there to help when Canada is in need. They will be there to serve. Right now, we have not received any specific requests. There are no plans underway to have the Army intervene.
And a follow-up, right?
You said on Friday that you intend to stay at home, even if you and your family are now healthy. Is this to show the example? Many people are saying, well, you're the leader of the government of Canada. Can you be as efficient during this crisis by working at home? We're very pleased that Sophie has been given the green light. She has been symptom-free for a few days. She went to Harrington with the children. I continue to working from Rideau Cottage. Many people have been asked to work at home. If you think about it, I was in the same house with a person who up until a few days ago was diagnosed positive with COVID-19. And so the countdown will continue because theoretically I could have got it a few days ago. So I'm going to continue to self-isolate. Health Canada is asking us to do this. That's a recommendation. This is something that we're asking citizens to do as well, to stay home when it's possible. And as you can see, I continue to work each and every day. I work from home, and we're able to coordinate things and to do the necessary work.
First of all, I'm very happy, as many people were, to see that Sophie has been given the all clear. It's been a few days since she's been symptom-free. And obviously, I want to thank everyone who's sent messages of support. She's taken the kids to Harrington. I'm going to continue to stay here to do the work that needs to be done. And if you think about it, people are wondering why I'm still in isolation. Up to a few days before she was clear, I was still sharing a roof. We were being careful, but sharing a roof with someone who'd tested positive for COVID-19. So I have to continue in isolation in order to be sure that we're following all the protocols and the recommendations by Health Canada. The work that we're doing continues as a government. There are lots of companies and organizations around the country who are discovering that you can do an awful lot of work via telephone, via video conferences, and that's exactly what I'm doing, and I will continue to do it as so many Canadians are as well.
Thank you. Next question, operator.
Merci. Thank you. The next question is from Mia Rabson, the Canadian Press. Your line is open.
Hi, I'm wondering if you could talk a little bit more about what aid and help you will be providing to charities. I know several hundred of them made a plea last week for help to be able to continue. I think you hinted that there is something coming. Can you give some more reassurances that the charities that are being so relied upon right now will get some help?
Today we have announcements for charitable and nonprofit organizations specifically that have been doing a great work helping out our youth and our seniors. But we recognize there's much much more to do. Not only are organizations in the charitable sector and the nonprofit sector doing incredibly important work during very difficult times, they're also in many cases seeing their donations dry up and are very worried about their capacity to continue to do the work they're doing. That's why we're working closely with them, and we'll have announcements to make in the coming days about how we're going to ensure that they can continue to do this incredible work that is so important for Canadians.
And a follow-up, Mia?
Yeah, I'm also wondering, are you concerned at all that you're putting too much pressure on airline staff, check-in staff, people at the train stations to screen people for COVID-19?
We already know that an awful lot of people are not traveling, have listened to the recommendations to stay home, to avoid non-essential travel. This is extremely important. And from the very beginning, we told people that if you have COVID-19 symptoms, you need to stay home. You should not travel. You must not go out. That's going to continue to be the instructions we give, but we've also asked airline and train staff to ensure that nobody with symptoms boards their planes or trains.
Thank you. Next question, operator.
Thank you. Merci. Next question. Prochaine question. Lina Dib, La Presse canadienne. À vous la parole.
Oui, bonjour, Monsieur Trudeau.
Hello, Mr. Trudeau.
Ce même sujet, vous dites que vous n'avez pas
You said
de l'armée pour l'instant,
that you don't require the services of the armed forces, but can you expect that this could be useful and necessary when we see what's happening in Quebec? It's a large geographic area, and we need to intercept those who continue to travel. The Canadian Armed Forces are there to help communities and those in need in Canada. We're looking at different possible scenarios where this extra help could be used, but we're not there yet. We're not there today. We're going to continue discussions with the provinces, with different regions, to make sure that we can do what's necessary. We're not closing the door to any possibilities, but we're making decisions as things evolve. Yes, I have another question. Does your 14-day countdown begin today? We're going to continue following the recommendations. I think that that's one way to count it, or even a few days less, because Sophie received the all-clear a few days ago. But we'll keep you apprised to the press conferences that will continue here at Rideau Cottage.
One more call. Operator, please.
Merci. Thank you. Next question, Alex Boutlier, Toronto Star. Your line is open.
Good morning, Prime Minister. You announced a whole lot of different, funds and measures for small businesses, but a lot of small businesses are having trouble navigating through what you've announced in terms of tax deferrals, wage subsidies, credit availability, that sort of thing. Groups like the CFIB are trying to help them navigate this, but are you considering anything from the federal government to make it easier for people to access the funding that they can access and getting the funding to the right people?
We are doing an awful lot of things that have never been done before by any government in this country. There's never been a reason to. And as we're developing new policy solutions, new ways of helping out people so that we can get through this time and come out the other end of it stronger than ever before, we need to really figure out both what those things are and to ensure that people are going to be able to access them. We are putting out as much information as we can about the different options, and I recommend people go to Canada.ca to be able to find more information about it. I know there are organizations, whether it's the CFIB or banks themselves, that are giving advice around these new measures we're coming in, but we're going to continue to communicate as best we possibly can so that everyone is able to access the help that's there for them, even as we create new ways to help people. I recognize the challenge, and we're going to continue working on it.
And Prime Minister,
je reconnais que c'est juste une seconde, Alex.
Hang on just a second, Alex. I recognize that we are doing many new things. We have new programs, and it can be difficult to try to find exactly how to obtain the help. This is why we're going to continue to try to give out all the necessary information to citizens, to businesses, so that they can have access to the help that they deserve. We're going to continue working with organizations and even banks to make sure that information on all the help available will be accessible for people who need it.
And your follow-up, Alex?
Prime Minister, there have been numerous reports that prisons are of particular concern. Prisoners are concerned about the measures in place to protect them from the outbreak if it reaches prisons in Canada. Well, what do you say to prisoners who are concerned right now that they're dealing with one bar of soap per week and no other countermeasures?
We are very concerned about the fact that our correctional institutions could be places where there could be greater vulnerability to COVID-19. That's why we've been working very closely with Corrections Canada, and I know Minister Bill Blair, Public Safety Minister, will have more to say on this. This is something that we are digging into very carefully because we need to make sure we're keeping everyone safe in this country. Okay.
I recognize that our correctional institutions are more vulnerable than other places. This is why we're going to continue to work with Correctional Services Canada and Minister Blair to make sure that we're doing everything so that everyone is safe.
Thank you. We'll now go to questions in the room.
Ian Wood, CTV News. Prime Minister, this morning you made a small announcement for with regard to seniors giving money to charity groups there. But what about those that are on fixed incomes, seniors who have watched their investments and their retirement savings dwindle away on the market? Are we going to see any increases to CPP or other provisions for them like you've offered to workers and small businesses?
Our focus right away has been figuring out how to ensure that we can replace sources of income and revenue that have been lost because of COVID-19 for so many Canadians across the country who were relying on their paychecks to get through from week to week until this actually hit. But we recognize that seniors are facing greater vulnerabilities, and we are looking carefully at measures to be able to support them through this tough time as well.
Okay. And the Dutch government has sent back 600,000 masks to China that they deemed were defective. I'm wondering, when will we receive the masks that China has said they're going to send to us, and what assurances do we have that they will be effective? And have we seen a thaw in our relationship with China in the course of this crisis?
We will be receiving equipment, masks and gloves and gowns from China extremely shortly in the coming days. And at the same time, I can assure people that Health Canada has very strong procedures for evaluating, for ensuring that what we get is up to the necessary standards, and there will be no corners cut on this one. We need to make sure that the equipment that our healthcare workers rely on to keep them safe as they keep us safe is of a quality that is going to actually do the job. And we're going to continue to engage with the world and try to work collaboratively through this difficult time. It is a global pandemic, and countries need to set aside their differences and work together to get us through this as best possible, and that's certainly the approach that we're taking.
Abigail Beeman, Global News. Prime Minister, in the case of the Quarantine Act and also in the case of the measures announced for travelers yesterday, there's been no clear information about enforcement for those who break the rules. And yesterday in Ontario, we saw a snitch line for price gougers. I'm wondering if you can provide more information about enforcement in general, and also wondering, are you encouraging Canadians to report other Canadians who aren't following the rules to local authorities?
I think, first of all, it's really important that we all follow the rules. What we do today, what we've done over the past few days, what we will be doing over the coming days will have a direct impact on whether or not Canada is able to make it through this crisis in the best possible way. It'll have a direct impact on our healthcare workers. What we are choosing to do right now, these weeks, will affect deeply whether and how we get through this crisis and get out the other side better. So I really impress upon everyone the need to self-isolate, to follow the rules, to make sure that we are not putting ourselves or our neighbors or our communities at risk. Health Canada does follow-ups with people in terms of respecting quarantine. That's an important part of what we do. And I would really encourage Canadians to continue to spread the message, share with each other how important it is to continue to stay home.
I'd also like to ask you to respond to reports that we're hearing about how truck drivers deemed essential workers are being treated when they cross the border, not having access to washrooms or restaurants, and some just being made to stay in their trucks.
We are very concerned with the need to continue essential services, and that includes obviously supply chains that are so important for keeping people fed, to keeping people with the medications they need through this difficult time. We continue to work with folks at the border to ensure that the smooth flow and respectful support for these essential workers happens at the same time as we're ensuring safety for our citizens. It's always a challenging balance to establish, but we need to keep working to try and make sure that we can continue to get these essential goods while people are taking risks by continuing their essential work.
Bonjour, Monsieur le Premier ministre. Christian Noël de Radio-Canada. J'aimerais revenir sur ce que vous avez dit.
Christian Noël, Radio-Canada. I'd like to come back to what you said a couple of minutes ago. You're working on different scenarios involving the Army, especially for Montreal. Could you specify on what scenarios you're working on and why? Since the beginning, we are preparing for different types of scenarios. And where COVID will hit harder, or where things are going well. Some regions, some pockets have more cases. Our armed forces will always be there to help Canadians. I know that they had assistance scenarios in case of flooding in the spring. We'll continue to work with the regional authorities, the provincial authorities, with the City of Montreal, with all cities throughout Canada to respond to emergency situations that could rise. But we're not going to make any hypotheses. If we have to take additional measures, we are going to take things one day at a time. We're going to prepare for every scenario. You don't want to talk about it, but does this apply only to Quebec? Are there other provinces that are having conversations with you to call in the Army? We'll always respond to the needs raised by any province if they're asking for federal assistance. I don't want to speak to what province might or might not ask for assistance. We will be there to provide help to provinces, to provide help to Canadians so that people can remain safe during these tough times.
Thank you. We have time for one more question.
Ashley Burke, CBC News. Prime Minister, there are towns and there are cities across the country who are preparing arenas and community centers to prepare them into makeshift hospitals if needed. What does that tell you about where we are in the arc of this crisis? And as well, what does it say to Canadians about their hospitals' capacity?
I think it's a message that we are preparing for every eventuality. We are hopeful that the behavior that people have engaged in will keep numbers to a manageable level of people affected who need hospitalization, and that is why we are working extremely hard to encourage everyone to stay home and to not risk spreading this virus further. That is how we will control the spread. Our healthcare systems are designed to function close to capacity in normal situations. Day in and day out, we need our hospitals to be able to handle normal surges, whether it's during flu season or after an accident or an illness. We have a health system that works pretty well to handle the needs in regular times. These are not regular times, and therefore it is appropriate and necessary that we look at how to expand our health system to handle unprecedented numbers in an unprecedented crisis. And I want to commend all the people who are looking at alternatives that we all hope we won't need, that indeed we will not need if people continue to take seriously the directives and stay home and self-isolate. But it is simply responsible for us to be thinking about worst-case scenarios and preparing for them just in case we do need them.
There's been a huge wave of snowbirds and spring breakers returning to Canada, and there's a potential that we're going to see a surge because of that. How prepared is Canada's healthcare system to deal with that surge?
This is why we are impressing upon everyone how important it is that if you return from travel, that you isolate for 14 days. It is extremely important that everyone isolates. And there have been a few questions recently about, well, does that mean I can go for a walk if I keep separate from people by 2 meters? It's very simple. According to Public Health Canada, you can go for a walk unless you have tested positive for COVID-19, unless you have symptoms of COVID-19, or unless you have returned from overseas or outside the country within 14 days. And when you do go outside, make sure, if you don't have any of those three categories, make sure that you are keeping your distance. Don't gather in groups in parks. Keep those distance. And if you are in quarantine or self-isolation and you need some fresh air, open a window or step outside onto your stoop if that's a private place. But really, we need people to be abiding by the rules that public health has put out, particularly people who've returned from travel outside the country.
But can the healthcare system actually deal with the surge?
We are ensuring that we're able to deal with this surge. People are putting emergency measures in place, but we are hoping that there won't be a surge because we have seen other areas overwhelmed, even if they have strong healthcare systems. That's why it's so important that everyone abide by the instructions given. Merci tout le monde. Bonne journée.
Thank you, everyone.
That was Prime Minister Justin Trudeau updating
Hello again, I'm
Canadians on the
Marc-André Cassette, and you've been